Hi, this is Adriana Crossley from the Autism Society of Texas, and uh, we're doing this Facebook Live. Thank you so much for joining us. We're very excited to do this presentation for toilet training, incontinence, and um, especially because we are uh, addressing it for all ages. Let me share my screen. Thank you so much, Mariah. And a few programs, like I say, here in the Autism Society, we always try to have the latest information and trying to support our families. And we're hoping that this presentation is helpful. We're going to be talking about toilet training strategies and resources for all ages. And one of our presenters, Dr. Hannah McNall, she's been with us before, and we did a presentation with her last year. She helped us talk about challenging behaviors. If you have time to go look at that presentation, I really recommend it because there are some amazing tips and things that we can all learn from. Dr. McNall is assistant professor of educational psychology at the University of Texas in San Antonio. She's a doctor level board certified behavior analyst, and she's also licensed as a school psychologist in the state of Texas. Dr. McNall has worked in different school districts, and she's provide behavioral assessment, treatment, evaluations, and all kinds of support for children with academic and behavioral needs. We're very excited to have you again, Dr. McNall, and thank you so much for being here.
All right. And do you want me to take over and present now?
Yes, thank you. Yes.
Excellent. Yeah. So thank you all for being here today. And that was a wonderful introduction. My name is Dr. Hannah McNall, and I was so excited to be invited back today to present again in the seminars across the spectrum. Just a wonderful resource, wonderful thing that is available to our families. And so I'm happy to be here today. Just a brief disclosure, I am an expert in the assessment and treatment of challenging behavior, but I am not an expert in toilet training. I've done a variety of toilet training protocols. I supervise my practicum students in our university supported clinic in toilet training, but my area of expertise is in assessment and treatment of challenging behavior. So I am happy to field all of your questions. I will do my very best to answer all of them, but should I need to kind of take your contact information, I'm happy to go and seek out the answer if I don't have one readily available for you. Okay, so toilet training, I think, could be spread over multiple days for many hours because it is so, it's a huge life event, but it also presents with many individual challenges and individual behaviors. And so I'll do my best to provide a brief overview in the next 20 minutes or so. So first, I want to start out by talking about the importance of toilet training. So toilet training is a huge milestone for all children. Typically, developing children typically master or are considered toilet trained around 2.5 to 3 years or so. And then for individuals with autism and developmental disabilities, that average tends to increase a little bit to be between the ages of 3 and 3.5. However, there are a greater percentage of children who go into adolescence and into adulthood that still need support with toilet training. And so I just want to keep that frame in mind as we're kind of talking about these strategies. However, it is so important at any stage of development to work on toilet training to increase a person's independence because that improves their overall quality of life and increases social opportunities. If you can go to the restroom by yourself, you are able to access your environment in a much more free way, without having to require a change in diaper or have assistance from somebody else to do that behavior. It also provides respect for the individual and their own independence and dignity. It improves personal hygiene and improves overall well-being. So working on toilet training is very, very important, and working towards steps towards independence is also very important, because every step towards independence gets closer and closer to attaining these huge milestones and important outcomes once toilet training has occurred. There are a variety of obstacles, and like I was saying before, I've seen a lot of these different barriers in my clinical practice, but some of the common ones are there might be a physical or medical reason why the individual is still having accidents. It might be that there is some gastrointestinal issues, there is constipation that then is medicated and then treated and results in different forms of bowel movements. And so there's just a variety of other comorbid things that might be going on to impact someone's readiness and ability to engage in toilet training. When there are delays in language, so receptive and expressive language, so being able to understand and follow certain directions through that receptive language, as well as being able to express when the individual needs to go to the bathroom are very important. And if that is delayed, it is possible that toilet training can be a little bit more difficult. Clothing, I have a 9-month-old daughter right now, and whenever I am changing her diaper and I find that my husband has put her in an outfit that has about 1 billion buttons, I am just like, oh my goodness, right? And so as you know, we try to teach toilet training, considering clothing is very, very important. Their little fingers and their fine motor skills, it can be very difficult to feed that button through the loop or to put that zipper in the lead and pull it all the way up. And so those are definitely an obstacle. Fears, which I'm going to talk about more on the next slide. Recognizing body cues. So understanding that sensation of when you are needing to relieve yourself. If you feel like, oh, you know, I really got to go to the bathroom. That's not something that we are born understanding and born being able to recognize first, and then second, communicate that to others. And so starting to understand those body cues can be a little bit tricky. And then for our individuals with autism, one of the key characteristics is the insistence or need for sameness, right? We have that rigid pattern of behavior. We have that preference for things to be just so, or for things to be the same across days. And so changing the type of clothing or material that is used during toileting can be a little bit aversive or unpleasant to the child or to the individual who is undergoing toilet training. So I'm going to talk about that a little bit as well. So with fears, I see this a lot in clinic, is fears of, you know, maybe the child or the individual has fears of loud sounds or sensitivity to loud sounds. And in the context of toilet training, flushing that toilet, it can be very loud. Think about the toilets that have the 2 buttons versus the ones that kind of like shoot down. It can be very loud and unpleasant at times. And so one way to overcome that fear or overcome that barrier is to provide some noise blocking headphones, or have the individual engage in the toileting behavior. And then once they are done, the child leaves the restroom and the caregiver or the adult flushes the toilet up until they're able to tolerate that sound. So today we're going to focus on toileting, but that could also be a goal of working towards desensitization and willing to tolerate that sound of the flush once toilet training has been mastered. I've worked with kids that have a fear of just sitting on the toilet in general. And honestly, I don't blame them. They're like, you want me to sit on this thing with a large hole in the middle? That's crazy. I don't want to sit on that. I wouldn't sit on something with a hole in it, in the regular environment. And so there's a couple of strategies that we've tried and some that I really like. So you've all seen those child-sized seats, or the ones that make that hole a little bit smaller. That is definitely an option. Raising the ground from when they're sitting on the toilet. I don't know about you all, but it's sometimes just very uncomfortable to sit in a seat and your feet are dangling and your legs are dangling. And especially like we're going to talk about, if you're sitting on the toilet for long periods of time, your legs can start to get tingly and numb. Like all around, we can work proactively to avoid those sensations. And then we can also pair the presence of the toilet with a preferred item, such as bringing a toy to the toilet. Another one that I have really enjoyed, which was creative, is my student one time. She allowed the participant to face the toilet backwards and gave them washable markers, and they colored all over the lid of the toilet seat. So kind of pairing a fun activity with sitting on the toilet so that the toilet becomes less and less scary over time. And then the third one here is there can be just a general fear of switching to underwear, right? It's that insistence on sameness. It's that familiarity of, I've been wearing diapers my whole life. What do you mean? I'm not going to wear a diaper this time. Now you want me to wear these underwear. So I'll go over 3 different methods for how to transition from diapers to underwear. But before I do that, just one interesting way to promote the use of underwear is to go shopping with your child, or go shopping with the individual and have them pick out underwear that they like. They make some with really fun characters and graphics and things like that. So involve them in that process. Oh, sorry. So there is 3 methods to switching to underwear. You can put the underwear on and then put the diaper on top of the underwear, and then slowly cut away across days the presence of the diaper. So you can cut like a small hole, and then each day you cut a little bit more of that diaper until it's just the band around the waist. You can also put the underwear on and put the diaper on top. And at first you put it on normal, and then each day you progressively make the diaper looser and looser. Or you can do a mixed method where some parts of the day the individual is wearing a diaper, and other parts of the day the individual is wearing underwear. So it's a little bit of mixing the 2 types of underwear. Really important before you begin, I have a lot of parents that come into our clinic and say, I really want my child to be toilet trained. And so I ask about the readiness of not only the child, but of the caregiver and other family or other, stakeholders that work with that individual. So we want to make sure first that the child is ready. So if you try to do toilet training too early or before the child is ready, it's not likely to be effective, and it's likely to cause a lot of anxiety, maybe some challenging behavior, just further promoting like poor associations between going to the bathroom and toilet training. So you want to make sure first that your child is ready, showing signs of interest or discomfort with a dirty diaper. They should also be able to remain dry for 1 to 2 hours. And like I was saying before, with those receptive language skills, they should be able to follow simple instructions. So if your child is ready, you have to ask yourself, are you ready? And is your family ready? Because it is quite a time commitment when you first start. You want to make sure that you have a few days in a row, to maybe a week, that are available for full-time training. And additionally, some of the methods we're going to talk about today require data collection. And so thinking about the time commitment, if you're doing multiple trips to the bathroom where your child is seated on the toilet for 5 minutes at a time, that doesn't work really well if you are trying to maintain your regular schedule of activities or go to work and so forth. So finding a time, maybe a break, spring break, Christmas break, something like that, summer, where you have a good certain number of days that you can fully commit to toilet training. And so if your child is ready, if you're ready, and your family member is ready, if all signs are go, it's all about being consistent. So making sure that everybody is on board. And so I put family members here, but that can also be other service providers, teachers, etc. So before you get started, it's very important that you identify times to practice, that you identify a highly preferred item to use as reinforcement for appropriate toileting behavior. And this item should be something that you can restrict outside of toilet training. So it should be something that is just used to reinforce appropriate behavior associated with toilet training. You want to set achievable goals. Like I said before, getting everyone on board and then starting when you're both ready and having a plan in place. And so we're going to talk about some of those plans. So developing a plan, when you are thinking through how you want to do toilet training, what is best for your child, what is best for your family, teaching toileting as a whole routine is more ideal than just focusing on sitting on the toilet. It's important that you use words they know and that everyone that is involved in toilet training is using the same language. I love pictures. Pictures are always really helpful. And so I have an example here on the right of kind of a step-by-step of how you should engage in the toileting sequence of behaviors with pictures to model what that actually looks like. It is important to teach toileting on different types of toilets. I mentioned before the different flushing sounds, and not each toilet is the same. But when you are starting with toilet training, I do recommend starting with the same toilet, at least initially. And then once your plan is developed, again, making sure that everybody is familiar with what you're trying to do, with how they can support, and what method you are going to teach. And so we're going to go over two. This is not an exhaustive list. I'm just going to talk about the frequent sit method and the scheduled sit method. So the frequent sit method is you set a timer for 30 minutes and you prompt and bring your child to the restroom to sit on the toilet every 30 minutes. And your child should be sitting for up to 5 minutes. And remember, I was talking about the legs going tingly and all those things, right? Because if we are trying to have them, if we're trying to provide them with more opportunities to successfully void in the toilet, then that's going to require increased time on the toilet. And so one way to do this is to incorporate fun things to do during this time. You can sing songs, you can read stories, you can blow bubbles, trying to make it not as boring as, just sitting there on the toilet waiting for things to happen. If your child does void in the toilet, you want to provide lots of praise and lots of reinforcement. So pull out that item that you've been saving, the highly preferred item, and deliver that contingent on successful elimination in the toilet. So that can be either urinary or bowel movement. And then if after 5 minutes, your child still has not gone to the restroom, you should say, it's okay, you don't need to go. Right? Because every 30 minutes, if we sit on the toilet, a void is not going to happen every single time. And so you can say it's okay, you don't need to go, and then you can try during the next interval. If no accidents are happening during the break, you can increase the time between the bathroom breaks. So if they're still dry after 30 minutes and you're noticing that that is pretty consistent across the last number of times you've had them sit on the toilet, you can increase to an hour, maybe an hour and a half. but you don't want to stretch it too far that they're having accidents then in between. This one I like. It does take into account kind of their pattern of going to the bathroom while you schedule their sit. So instead of just going every 30 minutes and sitting for 5 minutes, you can look at, okay, how often are they going to the bathroom in their diaper, and then using that information to guide how you schedule the different sits. So this does require that data collection. So you can do diaper checks every 10 minutes or so. Now the diapers are pretty cool where they have a blue line that tell you when they're wet or not. And so you just want to look to see, okay, every 10 minutes, is it dry or is it clean or is it dirty? And then you'll identify the average time between the voids. So anytime between going to the bathroom in the diaper. And so if your child is going to the bathroom in their diaper, say every 2 hours, then what you'll do is you'll take, okay, on average, it's happening every 2 hours, and then you'll subtract 10 to 15 minutes from that average. So in the example of 2 hours, your scheduled sit time would be every hour and 45 minutes. And that's when you would prompt to go and sit on the toilet. And so you would set a timer for 1 hour and 45 minutes. When the timer goes off, you prompt the child to request for potty. That can be vocal verbal speech, that can be a picture communication card, that can be an alternative form of communication, such as on a device or sign language, but you want to have them request potty so that they start to associate that expressive language with the behavior of going to the bathroom. Again, they sit on the toilet for 5 minutes. If they successfully void, praise. I always tell my students when I'm supervising them, we throw a party when they actually go in the toilet and void appropriately, and then provide access to that preferred item. If they do not go to the bathroom, you can try again in 10 minutes. Note here that we don't restart the 1 hour and 45 minutes, because if they didn't void then and they're dry, you want to only allow 10 more minutes to pass before putting them back on the toilet. Then once they void, you restart that 1 hour and 45 minutes, whether or not it's successful in the toilet or in the underwear. What happens when they have accidents? So if you are able to see an accident happening in the moment, you should interrupt it, not make a huge deal out of it. Just say, oh, it looks like you're having an accident, or it looks like you're going to the bathroom. Let's go to the toilet. Guide them to sit on the toilet, encourage them to have any void. So if they already started going to the bathroom, they're not going to have a full void in the toilet. But if they even just tinkle a little bit or have a little bit of a bowel movement, you want to praise the heck out of that success. And then if again, after 5 minutes, they are not going to the bathroom, you can prompt them to get dressed, and then you resume your schedule. Challenging behavior. This is definitely something that is pretty common across families and children that I've worked with when doing toilet training. So if challenging behavior occurs, try to remain neutral. You don't want to provide a lot of attention. You don't want to have a huge response. You don't want to become very visibly upset. So remain neutral or try to ignore the behavior if possible. I've had kids try to pull all the toilet paper off the roll. Just casually put your hand on the roll and you can say, oh, we can use 4 squares or whatever it is. So just try to stay calm. Try to attempt to keep the child and the individual calm as well. And this goes for any time challenging behavior is occurring. I like to provide access to that reinforcer. So if they're trying to leave the restroom or be all done, I try to get some communication or at least some compliance before I let them leave. What we don't want to happen is challenging behavior occurs and you say, okay, heck with it, you can go, right? You want to get some type of appropriate behavior, whether that is being quiet for 10 seconds or whether that is requesting to be all done. You want to have allow them to leave and escape that situation contingent on at least some appropriate behavior. If there is just kind of an escalation, a huge outburst, and you're like, this is not working right now, we are not going to accomplish the goal here, have a plan in place for how to reset. And so that might be just taking a break for a little bit and restarting the next day. Whatever that looks like for you, if that is getting up and singing a song with your child or giving them a hug, whatever they need to become calm again. And once they're calm, you can reflect on what went wrong and then try again the next day. Regression is very normal. So if you accomplish or your child accomplishes their goal of toilet training, you might say, yes, we did it. We have successfully, tackled and finished toilet training. Our life is now wonderful. We don't need diapers anymore. I want to let you know that it is great to celebrate, but it is also very normal to have periods of regression. And when this happens, it's okay. You can take a step back, evaluate what specific part of the routine is going wrong. I highly encourage you to stick with the plan and not return back to diapers. That can be very harmful in terms of the long-term span of the goal, because your child can then learn, oh, I just have to have this many accidents and then mom or dad or sibling is going to let me go back into diapers. If you've made that transition to regular underwear, that is the way that we're going to go all the way through. And also, very important, rule out medical issues. So if they're having pain during urination or they're having a lot of small urinations, it might be a urinary tract infection, it might be other things. And so you want to rule out medical issues. So that might require a trip to your pediatrician or physician. And most importantly, don't get discouraged. Just know that it's part of the process. And as long as you stick with it and you stay committed, you'll get back on track. Real quick, nighttime toilet training. It's a little bit more difficult in the middle of the night. The three kind of ways that I would recommend approaching nighttime toilet training is using a chart. So, every time that they successfully have a dry underwear or dry bed in the morning, you can give them a star. And if at the end of the week they get 7 stars, then they get some sort of prize or reinforcer. Also, it just makes sense, restrict some liquids about an hour before bed, because if their bladder is not full, they're less likely to have accidents in the middle of the night. And if those two things are not working, I have worked with some families that will do scheduled wakings in the night to prompt their child to go to the restroom, and then you start to fade those wakenings out. But that can be a little disruptive to their sleep, to your sleep. And so I definitely recommend restricting liquids first and then using a reinforcement chart as well before doing the wakings. Okay, final thoughts. Perfect, 12:31. Final thoughts. Independence can look different for everyone. And so a step towards independence is just as important as your child coming up and saying they need to go to the bathroom. They go to the bathroom, do their duty, and come out, right? You want to acknowledge the wins. And if toilet training has resulted in your child telling you that they need to go to the bathroom, and they sit on the toilet and they void in the toilet, but they still need help pulling their pants up and buttoning them, that is okay, right? We are always working towards independence. It doesn't have to be one or the other. And so just keep working towards that goal, whether you have a child who is young, whether you have an adolescent or you have an adult child. Everybody can benefit from increased independence. It is not they're toilet trained or they're not, right? Maybe they still wear adult diapers, but they come up and they tell me that they have a soiled dirty diaper and that they are ready to go to the bathroom. I've worked with a lot of adolescents and adults that will do that. And we go in and they lay there and they're relaxed and they're calm. And that is much better than where we had started, where going to change diapers was a battle every time. And so every step towards independence is just as important and just as great as 100% independence. So don't discount the small wins. And then I have some resources here that I liked, and there is a data sheet. And so I can post these in the chat or provide them later on, but I just wanted to share some of these. And so that is it for me. Thank you all so much for being here, and I'll stick around to answer any questions. Thanks.
Thank you. Thank you, Dr. Hannah. This was so great. I really connected with many parts, especially when you were talking about the regressions, not to get discouraged. With my son, it was like when he got potty trained, it was like what you said, it was in stages. So he was potty trained during the day. But then every month or so, he will have a regression. And it was just like kind of, we almost could track it like cyclical and prepare for it. But it's just keeping working on it. It became less and less long. Like the periods started to become shorter. So I think those are great advice for the families, not to get discouraged.
Yeah, and to stick with it, stay consistent. Because in the small view of time, it might seem like a great regression, but like you're saying, now you can reflect back and look and see, okay, it's a pattern. It is cyclical. It happens every month, but maybe now it's every month and a half or 2 months, or the regression period is shorter and shorter. Maybe it's just one day versus where it used to be a couple of days. So it's really important, and I'm glad you shared that perspective.
Yes, thank you. This was great information. We're going to continue with our presentation. We're going to have Janet Firestone talking to us. She's a manager at Tranquility, manager of sales and account executive. Um, Janet is a medical expert for Tranquility, and which is a leading manufacturer for super absorbent incontinence products. Janet's been working for about 25 years or 25 years with medical recipients, families, caregivers. She helps families find the right coverage. She educates families on what products are appropriate for our kids' incontinence needs and kids and adults. This is something that goes to different ages, and like Dr. Hannah was mentioning, also it's a process. So many times uh, teenagers or adults, they may be potty trained for during the day or for certain things, but they still need some products during the night or for certain for traveling or for something that they're still working on. So as part of this process, we need to know which products are available, and Janet is going to talk to us about that.
Great. Thank you so much for having me today.
Thank you.
I am going to talk to you about autism and incontinence products. I'll jump on camera at the end of my presentation because I have so many things I want to cover. I want to make sure I hit on every point. So the next slide. Children with autism may experience delays with potty training, and therefore they may need pull-ons, disposable underwear, or diapers, tape tab briefs for a longer period. Next slide. We also know that products sold at the grocery store or big box stores are typically made for light incontinence, meaning pull-ons or diapers that absorb just a small amount of urine. In Texas, there are medical supply companies across the state, also referred to as DMEs, durable medical equipment, or HMEs, home medical equipment. These companies can provide super absorbent pull-ons or diapers designed for heavier incontinence, meaning pull-ons or diapers that absorb a larger amount of urine. One of the most common needs for more absorbent pull-ons or diapers is for overnight use. Children who are not yet potty trained may experience heavy bedwetting at night. Next slide. So let's talk about choosing the right products. We often hear parents have a difficult time finding products in youth sizes. We hear stories of skin irritation because a child is still wearing a baby or toddler-sized pull-on or diaper that is tight-fitting and irritating the skin, such as a pull-on or diaper sold at a grocery or big box store. Those typically only go up to about size 5 or 6. Youth products are specifically made to fit children ages 4 and over, so beyond those sizes 5 and 6, all the way through adulthood. So requesting a sample is the best way to ensure you're using the right size product for your child or family member. Next slide. So now we will talk about incontinent product information that affects people of all ages. Complex healthcare needs typically require incontinence products that can absorb larger amounts of urine. It's important to understand the difference between a super absorbent product and a lower performance fluff incontinence product. I often tell parents, think of low performance fluff products like a wet cotton ball. If you get cotton ball wet and then you squeeze it, the moisture just squeezes out. Super absorbent incontinence products are designed to lock in the fluid that has been absorbed so it will not let the moisture squeeze out. Next slide. So let's talk about the importance of protecting the skin. If the skin is exposed to moisture or urine from wearing a light incontinence product like those purchased at the grocery store or big box stores, it can lead to all sorts of complications. Skin irritations develop within 15 minutes of urine exposure to the skin. Skin irritations lead to rashes or potentially into skin breakdown and infections. Bacterial growth from exposure to urine can lead to things like UTIs or urinary tract infections. UTIs can lead to more serious complications such as fever and infection that may require medical attention. Unplanned expensive visits to the doctor, urgent care, or an ER. Infections like rashes or UTIs can also lead to frustration or challenging behaviors. There are simple solutions to help avoid these risks, using super absorbent products to match each individual's needs. Next slide. So here are some more reasons why requesting higher quality, more absorbent products for incontinence care is so important. Choosing more absorbent products reduces the feeling of wetness, leading to frustration if one has sensory issues to feeling wet. Other things to think about when choosing a product, a pull-on or product feels more like underwear and can support your efforts in potty training, learning that repeat routine of pulling a disposable pull-on underwear up and down, just like regular underwear, encourages potty training, just like Dr. Hannah said. Choosing a soft cloth type incontinence products versus a poly or plastic type product can also support potty training efforts too. Soft cloth products seem to work best for those with sensory issues versus those with poly or plastic. Choosing a more absorbent product can allow your child to wear a product longer with minimal changes. A few years ago, I worked with a special school in Florida for autism. The school staff noticed that children in the classroom who wore super absorbent products required fewer changes during the school day. They also noted a reduction in staff required cleanup time from low quality products that leaked. We've been discussing the possible complications of urinary incontinence. For those experiencing fecal or bowel incontinence, here are a few product tips for managing loose stool. Disposable garments with leg cuffs can help to contain solid stool and channel loose stool to the core where it can be absorbed better. There are booster pads products that we will talk about on the next slide that are designed to boost a diaper or pull-on's absorbency and even help manage loose stool. Next slide. So let's talk about a few types of incontinence products that will help provide improved skin protection, comfort, and quality of life. We will start with the booster pads. Booster pads are a flow-through insert pad that can boost the capacity of any brand of pull-on or diaper. Many parents call booster pads diaper doublers, and they are especially nice to add to overnight products for heavy bedwetting. Some parents or caregivers like to use pull-ons during the day for potty training and diaper-style products with a booster pad at night when their child or loved one may experience heavy incontinence or bedwetting. If managing fecal incontinence or if a child or loved one is ill with diarrhea, extra large boosters with a wider hourglass shape are an excellent solution to containing loose stool. Using a booster pad with a pull-on or a diaper can help your child stay dry during overnight, on long trips on a plane or in a car. Getting a good night's sleep without disruption can improve your child's health and behavior. It's also so helpful for parents and caregivers to get a good night's sleep too, and keeping your child or loved one dry at night is absolutely key. Next slide. Here are a few other incontinence products you may not be familiar with. Underpads protect the bed, couch, chair, or other surfaces if pull-ons or diapers should leak. Parents often tell me they cover their child's mattress with underpads, then place the fitted bed sheet over top the underpads. If the child gets a small area of the bed wet during the overnight, they can simply pull off the fitted sheet, toss it in the laundry, pull up the soiled underpad, and then replace it easily before making the bed again and protecting the mattress. Disposable swim products are available in youth through adult sizes for those with incontinence to enjoy swimming in the pool during vacation or at summer camps. Next slide. So now let's talk a little bit about Medicaid coverage. If you don't know whether the person in your care is covered under Medicaid benefits, reach out to a local durable medical equipment DME supplier for assistance. We will provide a link to helpful resources after this presentation that walks you through these steps, along with how to request free product samples and how to get a list of product suppliers in your area that work with your Medicaid plan. In the state of Texas, if a child has Medicaid due to their diagnosis of autism, they may qualify for up to 240 units, any combination of pull-ons, diapers, or booster pads. Plus, they can qualify for up to 120 units of underpads or up to 2 packs of wipes. The state recognizes some children may not be potty trained by the age of 4 and may continue to experience urine or fecal incontinence. The state will assist you with getting a monthly supply of products. Once you set up your order with the Texas Medicaid incontinence supplier, you can get a monthly home delivery of supplies. Next slide. So I know many parents experience the frustration of trying to navigate Medicaid benefits. We often hear about parents paying for products out of pocket and they're unaware their child may qualify for pull-ons or diapers at no cost to them under Texas Medicaid. If your child has Texas Medicaid and you're paying out of pocket, you can get help by connecting with a Texas Medicaid supplier of pull-ons, diapers, booster pads, and more. The suppliers will work with you to get the required prescription paperwork to receive your monthly supply. You can ask your current supplier if they offer super absorbent products. Some suppliers may choose to just ship a lower quality fluff product. If your child needs a higher quality option, you can advocate for your child and ask for super absorbent products. Next slide. I know we may have parents or caregivers listening today whose child or loved one may not be eligible for Medicaid or in the process of applying for Medicaid. Here are a few options for you to think about when choosing an incontinence products for their care needs. Private pay, paying out of pocket. You can look for a local or national online retailer who offers super absorbent pull-ons or diapers. Remember, buying super absorbent products can help you save in the long run, avoiding complications that we talked about earlier, such as skin irritation, bacterial growth, infection, leading to UTIs. If you are paying out of pocket, your employer may offer a tax-free FSA, flex spending account, or an HSA, health savings account, which can be used to purchase incontinence products. Online retailers often offer coupons, free shipping, and discounts for monthly subscription orders. If you're struggling to pay for your child's product out of pocket or do not have Medicaid benefit, there are diaper banks across the country. Some food pantries also offer diapers or pull-ons. Our handout will include a link to these diaper banks, so please see the link in the comments for helpful resources. With that, I'll come online and we'll take questions and answers, and thank you.
Thank you so much, Janet. This was very helpful, and we really wanted to include this in our presentation and let families know that Medicaid may cover this, because we speak with families that are working on potty training in kids that are older, and they have Medicaid, but they don't know because nobody tells you that Medicaid may cover, for this product. So this is great information to give out to our families. And right now I have one question that was posted. And this may be for both of you. Maybe Dr. Hannah could give us some tips first, and then Janet could talk about a little bit what products could be used in this situation. And they're talking about how to address bowel movement accidents. They said that their son has autism and has been toilet trained since age 3, but he has bowel accidents about 3 times a week. Dr. Hannah.
Yeah, that's a great question. And I think I mentioned it briefly. We could have a whole separate conversation about bowel movements and the correspondence with the gastrointestinal types of other issues. And so my recommendation would be first to rule out medical. And so make sure that you have taken your child to the pediatrician or their primary care physician, expressed your concerns and tell them how long it's been happening, and make sure that there isn't any physiological reason why the accidents are happening before you go to intervene. And then if medical is ruled out, my next kind of set of questions, if I were working with you or a similar family on this issue, would be what happens after an accident occurs? Because there might be some type of consequence that is occurring that is somewhat reinforcing to the child. So if there is a very busy day going on and your child has an accident for a bowel movement, versus going to the bathroom for a urinary accident, that might require like a trip to the shower. It might require additional time with the caregiver to clean up the accident and to kind of reset. And so there can be different reasons why children will engage in more intentional types of bowel movement accidents rather than just not knowing or recognizing the sensation that they need to go to the bathroom. So my overall, answer is first rule out medical. And then if you are receiving ABA therapy or any type of other services, express that to another provider and see if you can work together to see why that might be happening. And then you can teach replacements or utilize different strategies to promote, less or completely getting rid of having those accidents.
Thank you. Janet, I don't know if you want to talk about a little bit about products for incontinence when it comes to fecal bowel movement incontinence.
Sure.
Products.
Yeah, I touched on it a little bit in the slide deck, but if someone is currently using a pull-on or brief style product, there are things like booster pads that we talked about that can help contain that fecal matter. You want to look for a product that has cuff guards so it can help channel that fecal matter into the core. But I think in this person's question, and Dr. Hannah touched on, they definitely want to rule out any type of medical situation. Certainly if they've already moved on from using disposable products, then they may just have to use them for certain situations. As Dr. Hannah talked on, pay attention to when the incident is occurring. So maybe it was a long trip on the school bus or something like that. So it might be that they need just a pull on for just that time period, just to help with those occasional accidents.
Yes, it's great. And it's always important. Many of kids with autism have GI issues, constipation. It's very common. And sometimes we need to remember that constipation may show as diarrhea in many cases. So even if they're having diarrhea, we can not rule out constipation, and it needs to be addressed by a doctor. So I have another question. It says, I need more help for my almost 14-year-old with being sometimes pooping in bed at night. First of all, a good nice Excel is now getting too small, and she adds a pad now. But should they start just underwear to get them up in the middle of the night? How often do they need to get them on? And also, they said they already eliminated drinks 1 hour before bed. So, what else can they do in this case, Dr. Hannah?
Yeah, perfect. I'm glad you are restricting access to liquids before bedtime. The nighttime is totally different than daytime toilet training. I mean, not totally different, but it presents with its own challenges. And so if they are, it also depends on how they're able to hold their urine, like how long it occurs. And so what I would recommend is seeing what is the time period between the accidents and then doing a scheduled waking before the accidents typically occur, and then coupling that with reinforcement. So whether that be through that chart or immediate reinforcement, but again, it's the middle of the night. So you don't want to say like, here's your iPad, go play with it, right? Like probably go back to bed and then we can provide reinforcement in the morning. But that is when I would start to move to that more invasive scheduled wakenings in the night, at least until you're back on track where those accidents are not happening anymore. And then you can slowly fade out. You usually want to fade out the wakenings that happen later. So wake them up earlier in that sleep cycle, and then they should be okay to go for the rest of the night. So yeah, nocturnal urenesis and incontinence is very common. Also, I want to say that as well. So your child might be completely toilet trained during the day, but nighttime is different. And so again, important to talk to a medical provider and rule that out first. But if you are restricting liquids and it's not helping, then I would go to that scheduled wakenings and use a reinforcement type of an approach. So maybe if they're having 3 accidents at night, you set that goal to be 2 accidents and provide reinforcement for having 2 or fewer accidents. And then you say, okay, the goal is to have none, but if you have 1 or fewer, you can have your iPad or you can have your Game Boy, whatever it is. And then once they're successful at that goal, then you reduce to 0. And so doing the awakenings to give them more opportunities to relieve themselves at night, as well as reinforcing fewer accidents than they're currently having. That should be, I would recommend that as the next step if you're already restricting liquids. You can also do an extended bathroom scheduled sit right before bed.
Yes, that sounds great, and I really like your idea of first paying attention to when these accidents are happening and schedule the awakenings before that. So if they're having an accident at 3 o'clock in the morning, maybe you can wake them up at 2 or 2:30.
Right.
And just to eliminate that accident. And it always helps for our son. He knows every time he's getting ready for bed, he needs to go pee before he goes to his bedroom. Like and it's part of his routine now to walk through the bathroom and pee before he goes to bed. For Janet, eh, they're mentioning that the Goodnight Excel is getting small. So is there any products, or that they could be using probably they're at the point to use adult diapers, right?
Yes.
Pull-ups.
So I think that, if you're in a product that's tight fitting, that could be leading to a little bit of pressure, like on the abdomen. And so all of a sudden, then those accidents may be occurring. So we want to make sure that they're in a properly fitted product. And again, there are products that are made for overnight use, as you're encouraging that toilet training process, but they can also keep them dry if there is an accident. And then, as I mentioned earlier, making sure that you have bed pads, and sometimes just put them under the sheet so that they don't know that we're encouraging toilet training, but it's just going to protect the mattress, and it's less frustration when they, and then they don't even feel the underpad underneath them. So a little less frustration, and then again, it protects that mattress. So there's just definitely products, and there are products that are larger than a Good Night's extra large. So we want to make sure that we help this family try some samples of something that would be the next size up.
Yes, that makes sense. Sorry. This question is for Janet. Says, does medical handle coverage for different levels of incontinence? They have 2 children with autism, and they have different incontinence levels. How does that work?
So again, it's going to go to depending on what your child's individual needs are. So maybe one child has a light incontinence, so they may be able to toilet train a little quicker and start right away with using those pull-on style products, so that they're learning to use that repetitive motion of pulling a product up and down, trying to self-toilet. And then if it's a little bit lighter incontinence, pull-up is going to work great. Maybe if they have a little bit heavier incontinence, they have to start out more of in a tape tab brief. Or as I mentioned, maybe during the overnight, they need to add a booster pad to kind of boost that capacity. So, there are all different types. We've learned through our experience and research that people try anywhere from 3 to 7 products before they find the perfect combination that works for their loved one's needs. So again, we'd be happy to work with this family to help them find various solutions for each child.
Perfect. Another question, that's probably for Janet too. Does Texas has any waiver programs that work with incontinence products? And I can help with that one too, if you want.
I know that there are a lot of waiver programs across the country. I am not 100% aware of all the Texas waiver programs, but I do know that it's one of those things where, again, you most likely want to work with the medical supply company to look at your insurance and then see what waiver programs they work with to see what would be covered.
Yes, and many times my experience and the families that I work with in this situation, the Medicare waivers are not going to cover anything that's possibly covered by Medicaid, because being a waiver, you have to be a Medicaid recipient. So they first want things to go through Medicaid, and if Medicaid's covering these products, so the waivers are probably not going to do that.
Absolutely correct. So they're always going to go for what products are covered by Medicaid, but if there is something that's not covered by Medicaid, it may be picked up by a waiver.
Exactly. So yeah, first try Medicaid for sure. So the next question say, if I figure my son wouldn't qualify for Medicaid incontinence product, what and who are other online retailers that provide these super absorbent products online? Would they be the same as the medical supply equipment companies? Their son is 14 and it's not potty trained.
Okay.
Thank you.
So sure, there's going to be the, as I mentioned, the medical equipment companies that are providers for the state of Texas that would bill Medicaid. But what you're saying is the child that you're working, or the family has a child that's not on Medicaid. So there's online retailers, there's local retail stores that may carry our products, but we'd be happy to send a list of suppliers or options for you. And again, try those samples so that you can get the exact product that you need. And then we'll connect you with, maybe retailers in your area or online retailers. And many of them offer discounts if you, they have coupons and discounts, as I mentioned earlier. And then if you get on like a subscription plan, they'll offer a reduced rate.
Perfect, thank you. So it seems like then this next question, the family is already getting products from Medicaid, but they're asking, what if my products supplier doesn't offer a super absorbent pull-on like Tranquility, even if I ask of it by a name? So
we would encourage you to, if we get a sample again to determine what product does work best for your child or family member. And then we want to make sure that we give you a list of suppliers, because you're not obligated to stay with just one supplier. So you can advocate for your child and choose a higher performing product, and then it may be that you'd have to switch suppliers.
yes. And Tranquility is covered by Medicare. That's like actually the next question, but it is covered by Medicare, right? Tranquility products.
It's finding the suppliers, and we would be more than happy to provide you a list of Medicaid suppliers for the state of Texas.
Yeah, this is great because this is for a mom that's been running on issues for her 32-year-old son. So like we say, like this is across all ages that we see these families that are in the process of toilet train or that they need these products. Uh, this is a question for Dr. Hannah. Can you speak to intervention strategies for kids who specifically withhold urinating or pooping until they are in a diaper? They will ask for a diaper and then go in the diaper, but will not release into the toilet.
Yeah, that's a good question. And I know that is somewhat common. Right now, I don't I'm trying to think because I was reading and refreshing refreshing on toilet training strategies this past week. And I know I read something on that. And I think, I may have touched on it before. Is it the fear of the toilet? Is it a fear of going into the bathroom or the certain sounds that is resulting in not wanting to eliminate in the bathroom? But I would also say that if you have transitioned to toilet training and you are you've done the cutaway method or the loosening method and you're now in regular underwear, then those accidents are going to happen in the underwear, because access to the diaper wouldn't be possible. And so just kind of seeing if the accidents continue to happen as even when you don't offer the diaper later on during the day, and seeing if that happens. But I would also like to ask for your contact information or a way to share resources, because I do remember reading something really, really great on that topic, and I just cannot for the life of me remember it right now. So I'd love to be able to share that resource with you and give you a better and comprehensive answer later.
Yes, and we can help you connect with that family for sure.
Thank you.
Do you have more time? Because we have a couple of more questions to comment, but I know we've run late. We can always answer people in the chat. So how do you feel?
Yeah, I can. I have another meeting going on right now, but I can give like a couple more minutes. So if maybe one or two questions, I'd be happy to answer. And then, yeah, if you have additional questions, I can answer them later or provide more resources.
Yes, thank you. The time, I wasn't even keeping track of the time. It seems like families really connected. They have a lot of questions about this. Dr. Hannah, one question. What is your experience or your point of view about urine alarms, those alarms that go in the underpants or the diapers, and they wake up the kid as soon as they start to wet? I know they may be controversial for some people, but what are your experience with that?
Yeah. And while I was reading, there's a lot of literature that has done kind of these package treatments where that is also included in the nighttime toilet training intervention. And so I don't have strong opinions on it, but I would say that given that's a more intrusive type of an intervention, I would try the other the other strategies first. And if it's still not working, so say you've reduced the liquids at night, you have done the toilet training success chart, and you've done the scheduled wakenings, and maybe the wakenings aren't working because they're just the accidents are happening at such a variable time. There's no consistent pattern. There can be a multitude of reasons as to why that is not working. Then I would say if you're interested in wanting to add that component, then by all means, I don't think it's harmful. I've actually read quite a bit of literature that supports that use. However, because it is more intrusive, I always say try the other things first and then add that if it's necessary.
Yeah, that makes a complete sense.
Mhm.
I got another comment, but it's just to thank you. They have a 14-year-old son that is working on nighttime training, so they really appreciate the information, and they're going to follow some of these tips. Thank you so much. Thank you, Dr. Hannah. I appreciate your time, and we also thank Tranquility for their support. Janet, we're really glad to do this presentation, and just to be able to offer this information for our families. We're gonna have the links for Tranquility and for the information that they prepare for us on the links. And we're also gonna have Dr. Hannah's links if you want to connect with them. And we will be monitoring the chat for more questions. So feel free to post anything else there. But we thank so much to the families that joined us, and thank you so much.
Thank you so much, everyone, and hang in there. It is a big process, but consistency is key, and you can be successful, whatever successful looks like for you and your child. And so keep it up and stay strong. You can do this. Thanks, everyone.
Thank you.
Bye.
Bye. Thanks.